Hello everyone, I'm Anas Al Ubaidi, and the topic for this session or for this lecture is obstetrical and gynecological or OB GYN note templates and reference sheets. And this lecture or this session, which is again the topic is OB GYN note templates and reference sheets, is within chapter 27 of review of OB GYN scribing, within the Certified Medical Administrative Assistant course program by ACMSO. Introduction. Obstetrics and gynecology, OBGYN, cover a critical domain of healthcare dedicated to the unique medical needs of women throughout various stages of life, including adolescence, reproductive years, pregnancy, and menopause. This specialty demands precision, sensitivity, and keen attention to detail, given its dual focus on managing general gynecological health and overseeing the intricate processes uh, of pregnancy, childbirth, and postpartum care. Within this framework, the use of structured note templates and reference sheets is essential in streamlining and standardizing documentation practices, ensuring that patient encounters in OBGYN settings are accurately recorded, clinically relevant, and compliant with legal requirements. OBGYN note templates serve as a consistent framework for documenting diverse clinical scenarios, whether it involves routine gynecological exams, prenatal visits, or emergency obstetric care. These templates help scribes capture essential information such as menstrual history, sexual health, family planning details, and obstetric histories using formats like GTPAL, gravidity, term, preterm, abortions, living. By following a standardized structure, scribes ensure that critical details are never overlooked and the provider can evaluate a comprehensive clinical picture efficiently. Additionally, reference sheets tailored to OBGYN settings, such as quick guides for fetal growth parameters, cervical dilation milestones, or postpartum care best practices, equip scribes with readily accessible knowledge to support complex and detailed documentation. The challenges of OBGYN documentation also highlight the indispensable role of advanced medical scribes. Encounters in this specialty often involve sensitive discussions about fertility, sexual health, or pregnancy loss, requiring scribes to document these topics with both compassion and clinical accuracy. Furthermore, documentation must remain precise to capture intricate diagnostic findings like ultrasound results, hormonal profiles, or fetal monitoring data. This level of specificity not only supports clinical decision-making but also mitigates risks associated with legal liabilities in cases of obstetric emergencies or gynecological surgeries. Scribes also play a vital part in bridging communication gaps within interdisciplinary teams. OBGYN often involves collaboration with specialists such as maternal fetal medicine, MFM physicians, endocrinologists, urologists, and mental health professionals. Clear and structured note templates ensure that all providers involved have accurate access to previous history, ongoing plans, and rationale behind clinical decisions. Whether documenting a patient's readiness for assisted reproduction procedures, recording prenatal or antenatal milestone data, or tracking postpartum mental health concerns, these templates often offer a cohesive and functional record that facilitates continuity of care. Key points. Organizing patient encounters with note templates, standardized template structures, OB/GYN note templates provide a structured framework that ensures all relevant aspects of a patient encounter are captured regardless of complexity. Standardized formats guide scribes through key areas such as the patient's history, presenting problems, and clinical findings. Consistency in documentation not only helps maintain thoroughness, thoroughness, but also streamlines provider workflows. Example, during a routine gynecology visit, the note template prompts the scribe to document menstrual history, contraceptive use, and any symptoms like pelvic pain or irregular bleeding, ensuring no critical detail is missed. Using a GTPAL for obstetric histories. One of the most important sections in OB/GYN templates is the use of GTPAL, gravidity term, preterm abortions, and living, to summarize a patient's obstetric history systematically. This format enables a clear snapshots of past pregnancies to support clinical decision making in ongoing maternal care. Example, a patient with a GTPAL of G3, T2P, 0A1L2 indicates three pregnancies, two full-term deliveries, no preterm birth, one abortion, and two living children. This information alerts the provider to possible risks for complications and subsequent pregnancies. And here is a diagram summarizing the OB/GYN note template process. Focused exam documentation. Templates also guide documentation of focused physical exams such as pelvic or breast exams, which are essential in both preventive and diagnostic care. Clear prompts ensure all findings are recorded with the precision needed for continuity of care. Example, while documenting a pap smear encounter, the template ensures the appropriate inclusion of cervical findings, sample collection adequacy, and results of HPV tests if applicable. Capturing social and sexual histories. OB/GYN documentation demands sensitivity and accuracy when recording social and sexual histories. Templates provide a non-judgmental framework to guide the scribe, ensuring these sensitive topics are addressed properly without omissions or biases. Example, for a patient presenting with recurrent vaginal infections, the scribe is prompted to document details about sexual activity, recent antibiotic use, and personal hygiene practices, as these factors may contribute to the differential diagnosis. Incorporating prenatal milestones or antenatal milestones. Prenatal visits involve multiple check-ins to monitor fetal development and maternal health milestones. Templates ensure that each visit systematically captures fetal measurements, for example, fundal height, lab results, for example, glucose tolerance, and maternal vitals like blood pressure. Example, at a 28-week prenatal antenatal visit, the scribe documents the patient's fundal height, a fetal heart rate, and results from gestational diabetes screening, along with the provider's plan for continued monitoring. Supporting clinical decision-making, diagnostic accuracy. Scribes play a pivotal role in creating clear, accurate notes that reflect diagnostic tests and assessments. OB/GYN's templates ensure that findings from ultrasounds, lab tests, or physical exams are contextualized within the clinical narrative, supporting the provider's diagnostic reasoning. Example, a scribe documenting an ultrasound report includes findings such as fetal growth percentile, amniotic fluid levels, and placental positioning, offering the provider a comprehensive basis to assess pregnancy health. Tracking risk factors. Templates help organize and highlight risk factors that may affect the course of treatment or pregnancy management. These sections ensure the provider can quickly identify and address potentially harmful conditions. Example, for a patient with a history of preeclampsia, templates guide documentation of routine blood pressure readings, lab results for proteinuria, and the provider's plan for risk mitigation. Medication and treatment plans, detailed and organized documentation of treatment plans in OB/GYN is crucial for chronic conditions like PCOS, polycystic ovary syndrome, or endometriosis, or acute scenarios like ectopic pregnancies. Templates prompt scribes to capture all prescribed interventions, patient instructions, and next steps. Example: when a patient is prescribed hormonal therapy for dysmenorrhea, the scribe uses the template to record dosage instructions, potential side effects discussed, and the next follow up visit. Ensuring continuity of care with interdisciplinary inputs, collaboration is key in OB/GYN, and structured notes support seamless communication between different specialists. Templates consolidate input from endocrinologists, maternal fetal medicine practitioners, and mental health providers for integrated care. Example: a scribe documents maternal a maternal fetal medicine specialist's recommendations for managing gestational diabetes, ensuring the details are available for the patient's primary OB/GYN prior to the next appointment, protecting against legal and regulatory risks. Clear and comprehensive documentation safeguards providers and high liability specialists like OB/GYN. Templates reduce the risk of omissions or unclear narratives that could be subject to scrutiny during audits or legal reviews. Example: detailed documentation of informed consent for a C section, including acknowledged risks and patient questions, ensures the provider complies with medical legal standards. Ensuring comprehensive documentation in women's health. Addressing sensitive topics with precision, scribes using OB/GYN templates are guided to document complex and sensitive situations, such as discussions about fertility treatments or options following a miscarriage, with clinical objective and respect for the patient's experience. With clinical objectivity and respect for the patient's experience. Example: during a consultation on IVF and vitro fertilization options, the scribe accurately records the patient's concern or concerns, planned diagnostic steps, and the provider's explanation of success rates and risks. Guiding preventive care, templates play a vital role in preventive women's health, standardizing the capture of essential risk services like breast cancer screenings, osteoporosis assessments, and sexually transmitted infection (STI) testing. Example: a scribe documents details of a patient's mammography referral, noting her last test date and family history of breast cancer, streamlining the follow-up process. Recording surgical and postoperative details. OB/GYN often involves procedures like laparoscopies or hysterectomies. Scribes must document preoperative assessments, intraoperative findings, and post-discharge instructions to ensure a complete record. Example: after laparoscopic surgery for endometriosis, the scribe records operative findings, patient's pain management instructions, and follow-up care schedule. Streamlining emergency documentation. Emergencies such as ectopic pregnancies or preterm labor require urgent yet thorough documentation. Templates ensure that these high-stress scenarios are captured systematically, avoiding critical gaps. Example: during a medical emergency, the template prompts the scribe to document vitals, provider actions like medication administration, and patient outcomes in real time. Aligning with billing and coding criteria, accurate and detailed documentation ensures that OB/GYN encounters align with billing and coding standards, reducing errors or denials from insurers. Templates simplify this process by prompting consistent and appropriate language. Example: for an annual well woman exam, the scribe uses the OB/GYN template to document required aspects like breast and pelvic exams, ensuring the visit meets CPT coding guidelines. Summary tables. Here is a table on key sections of OBGYN note template. Section, purpose, example, importance, risk of misuse or omission. Sections, patient history, physical exam, diagnostic results, assessment, and plan. Here is a table on common OBGYN diagnostic tools and applications, diagnostic tool, purpose, example, insights provided, challenges in documentation. Diagnostic tools, ultrasound, pap smear, glucose tolerance test, GTT, hysterosalpingography, amniocentesis. Table on risk factor documentation in OB/GYN care, risk factors, description, example, importance, risk if ignored. Risk factors, advanced maternal age, history of preeclampsia, family medical history, BMI above normal range, recurrent miscarriages. Table on OB/GYN routine preventive care documentation, care type, description, example, benefit documentation, risks. Care type, breast cancer screening, STI testing, HPV vaccination, osteoporosis assessment, and family planning. Table on challenges and solutions in OB/GYN documentation, challenge, description, example, consequences, solution. Challenges, we have handling sensitive topics, high volume data, quick emergency response, maintaining accuracy, ensuring patient confidentiality. And next, we will revise what we have covered through this lecture via some MCQs or multiple choice questions. Question 1. Why is the GTPAL format essential in obstetric documentation? A. It allows for better coding of gynecological screening tests. B. It provides a standardized summary of the patient's obstetric history. C. It helps predict the patient's current menstrual cycle status. Or D. It reduces the need for documenting individual pregnancy outcomes. Its answer would be B, as it provides a standardized summary of the patient's obstetric history. As GTPAL, gravidity, term, preterm, abortions, living is a standardized format that effectively summarizes a patient's obstetric history. This information is critical for assessing risk factors and tailoring maternal care. Question 2. What is the purpose of including diagnostic results, such as ultrasound findings in OB/GYN notes? 1 or A, to allow scribes to create patient discharge summaries independently. B, to support the provider's clinical reasoning and ongoing treatment plans. C, to replace the need for documenting physical exam findings. Or D, to minimize discussions with patients about their condition. Answer is B, as to support the provider's clinical reasoning and ongoing treatment plans, as including diagnostic results like ultrasound findings help document evidence-based clinical decisions and ensures that care plans are tailored accurately to the patient's condition. Question 3. How can OB/GYN templates help with managing sensitive conversations about topics like fertility or pregnancy loss? A, by automatically generating detailed text explanations for providers to use. B, by prompting factual and compassionate documentation of provider discussions. C, by eliminating the need to address emotional aspects as part of the clinical record. Or D, by allowing access to sensitive entries by a wider range of medical staff for review. And the answer is B, by prompting factual and compassionate documentation of patient-provider discussions as OB/GYN. As OB/GYN templates guide scribes to document sensitive conversations using objective and non-judgmental language, ensuring professionalism while respecting the patient's experience. Question 4. Which is the best example of using OB/GYN documentation templates to ensure continuity of care across providers? A, consolidating follow-up instructions for multiple specialists into a new patient chart. B, limiting note entries to only immediate obstetric findings and excluding historical data. C, documenting patient vitals without referring to previous trends or concerns. Or D, excluding interdisciplinary recommendations to prioritize the OB/GYN's plan. Answer is A, consolidating follow-up instructions from multiple specialists into a new patient chart. as continuity of care relies on the ability to share accurate and detailed information across providers. OBGYN templates help Scribe consolidate all inputs, ensuring a cohesive and clear care plan. Question 5. Why is detailed documentation of preventive care, like STI testing or mammography referrals, important in OBGYN settings? A. It replaces the need for patient education about potential health risks. B. It ensures compliance with legal reporting and supports reimbursement coding. C. It confirms that scribes completed the provider's delegated tasks independently. Or D. It allows skipping additional clinical exams during the patient encounters. Answer is B. As to ensure compliance with legal reporting and supports reimbursement coding, as preventive care documentation plays a key role in aligning medical records with billing codes and ensuring completeness for regulatory compliance, helping to deliver consistent and proactive care. And here we come to the end of this lecture. Thank you very much and goodbye.